disaster areas and have worked down in Louisiana and in the bayous with the people down there, trying to help them out with the wetlands falling down there.
Great. Well, welcome everyone. We're kind of a mixed group, so I'll probably tell some of you things that you know, but I'll try to make it interesting anyways. One of the things that I realized when I was thinking about what could I do to help is that healthcare people have a special skill that's missing in this whole climate issue, and that is the ability to talk about science in language that people can understand. And we don't realize how important that is. So what I've tried to do is take my experience of 30 years as a doctor, doing that every day, and read all the science and condense it for you so that I can explain it. So that's what we're going to do tonight. First thing I want to do, though, is I want to thank you for coming, because you know, the psychologists say that the problem in this country is not that we are full of climate deniers. It's that we have a lot of climate denial. And the difference is that climate deniers don't believe that climate change is happening, and people in climate denial know in their heart of hearts that it is, but the feelings that it brings up are so painful that they can't deal with it, and so they want to block the information and not look at it. And what are the feelings? Well, you know, helplessness, for one, fear and anxiety that you know, oneself or one's loved ones might be affected, some guilt because we know that the way that we live is contributing to that. There's a lot of different emotions, and one of the things that we have to do is we have to, as folks who want to move things along for our country of climate change, we have to start being able to talk about our feelings and help people with their feelings, because if someone is in that state of climate denial, the more you push information at them, the more they push back. So I recognize, you know, because I feel a lot of these things too, how hard it is to look at this issue squarely, and I want to thank you all for coming here and being willing to do that with me. And I'm going to tell you some stuff that's pretty bad and pretty scary, but then we're going to talk about solutions and about things that you can do. So so we're going to go into the darkness, and then we'll come out and back into the light. First, a little bit of science. So if scientists could speak regular English, this is what they would tell you. Carbon is the basic building block of life, and I've illustrated that for you by putting up the molecular structures of our 4 basic food groups. So, and the black balls in those little models are the carbon, so you can see how important they are in the frame of all of these important substances. So everything that was ever alive has carbon in it, and if you burn it, then that carbon combines with oxygen and forms carbon dioxide, or CO2, and that is the vast majority of the greenhouse gases, the gases that are causing the warming, are carbon combined with oxygen because we burned things. The problem is that we're burning twice as much as the planet can handle. So about 1/4 of that CO2 is absorbed by forests, another 1/4 is absorbed by the ocean, and the remaining half is accumulating in the atmosphere. And you can see from this is a chart that goes back 600,000 years, and you can see that the levels of carbon dioxide do go up and down, but right now we're at a point that is the highest that we've been in the last 600,000 years, which points to human activity. So what is that carbon dioxide that's collecting in the atmosphere? What effect is it having? It forms a kind of a blanket around the planet and traps the heat from the sun. And what effect is that having on us here? Well, it's making us warmer. So how much warmer? Over the last century, it's gotten about 1/10 of a degree warmer every 10 years. But since 1970, that has speeded up, and it's now warming about 3 to 6 times faster. And it's not even, as you can see. So this chart right here is showing you the temperature. Let me see, can I focus it better? I don't know that it's going to get any better. You know, when you're traveling by bicycle, weight and space are are very important, and so is that a little better? Okay, so the red states are warming by about 0.6 of a degree per decade, and the yellow states by about 0.2 of a degree per decade, and you can see that nowhere is it cooling. None of this is news to any of you, I'm sure, right? And the other thing, of course, is that our weather has become more extreme. The wet areas are wetter, the dry areas are drier. Some places have droughts and then floods. We're having hotter days, more heat waves, more frequently, lasting longer, and stronger storms. So how does that affect our health? Well, it affects our health because it affects the basic essentials that we depend on in order to be healthy. So this is going to be some audience participation in this talk. So let's all just get warmed up by going through what those basic essentials might be. Any thoughts?
Water. Water.
Food, water. Okay, anything else?
Clean air.
Air. Water. Food. One more. Safe place to live, right? Shelter. So climate is affecting all of these basic essentials, and I'm going to talk to you about how that affects our health. I'm going to do it by engaging you in a little bit of thinking and talking. So I'll tell you about some people that got sick and have you think with me about what might be the matter with them and what climate might have to do with it. So this is a case of a 10-year-old boy whose mother brought him to the doctor because of a cough that wouldn't go away. And he used to be a really active kid. He played Little League, he played soccer, but now he avoids exercise and spends most of his time in front of the computer. All right, the doctor's in the room. Okay, you've had your one. Yeah, this is childhood asthma. And what do you think, how do you think climate change could cause a kid to have asthma or to have worsening of asthma?
More pollution.
Okay.
Smoke from forest fires.
Yep.
Pesticides on the lawn.
Warmer climate? Okay, and how would that?
It makes it harder for him to breathe.
More humid. Hotter and drier.
Okay, well, let's go through some of this. So we're talking about air, how climate affects air. And the first thing we'll talk about is ozone. So ozone is good when it's up in the atmosphere, up high, screening out ultraviolet rays, but it is hazardous to human health when it's down low, and it's one of the pollutants that's regulated by the EPA. And about 40% of the American population live in areas that have ozone levels higher than what the Environmental Protection Agency says are consistent with good health. So what does climate do to ozone? Well, ozone, the ground level ozone that we're talking about forms when different pollutants that come out when things are burned combine in the presence of heat and sunlight. And so the more heat and the more sunlight you have, the higher the level of ozone. And so this is just showing you, this is New York and Atlanta, and along the bottom you see temperature, and along the side you see ozone levels. So you can see that the hotter it is, the higher the ozone levels go. It's in Missoula. I think the ozone levels get higher in the winter, but the warmer the winter is, the higher the ozone levels are going to go. Because when you have your temperature inversion and everybody's got their wood stoves on, and that gets trapped, then all those pollutants are sitting there. And if it's warmer, the winters used to be a lot colder here, right? Yeah, and so if it's warmer than it was, any amount warmer that it is results in a higher level of ozone. So what we know about ozone is that it's very irritating to the lungs, and it causes problems not only when the levels are higher than those danger levels that the EPA says, but also any increase in the amount of ozone for people who are very sensitive also results in an increase in asthma flare-ups and hospitalizations and emergency room visits for people who have lung diseases like asthma, emphysema, chronic bronchitis, those kind of things. And ozone also causes asthma. We know that kids are more sensitive to the effects of ozone, partly because their lungs are still developing, but also because they breathe faster than adults do. And every time you breathe in, you're getting another breath of ozone. And so the kids who do sports are breathing a lot faster. And so research has shown us that kids who live in areas that have high levels of ozone and play 3 or more outdoor sports are 3 times as likely to develop asthma as kids who are couch potatoes and don't go out and exercise. Ozone also results in deaths. And again, any increase in ozone has a corresponding increase in deaths, even when the level is below that EPA limit. And what was I going to say? Oh, yeah. Whenever you see a graph that looks like this, where it's got a straight line, and you're talking about some kind of hazardous substance, that tells you that there's no safe amount. Okay, because if there were a safe amount, that line would sort of have a curve and it would level out to some point at which it wasn't doing any damage. But this is, for every increment more you have, there's going to be some deaths, there's going to be some kids that get asthma, there's going to be some hospitalizations. And it's predicted that by 2030, or 2020, we'll have 3 million more extra cases of severe respiratory symptoms because of ozone related to climate, and that by 2040 we'll have 12 million more of those episodes just because of ozone that's a little higher because of climate. Pollen is another factor. Carbon dioxide is a fertilizer, and more for weeds than for crops, unfortunately, and it increases pollen production. So we now have higher levels of pollen than we used to, and the allergy researchers and plant researchers are predicting that by 2040 our pollen levels are going to double again. Not only do we have higher pollen counts, but the pollen season lasts longer. It begins earlier and ends later. And the pollen itself provokes stronger reactions. So for people who have allergies and asthma, this is a trigger for flare-ups of those conditions. We also, because in some parts of the country we're having very heavy rainfall, in terms of how much rain we're getting, it's only about 5% increase overall, but some parts of the country are having much more heavy rain, so 40 to 70% more heavy downfalls of rain. And in places like here, where you're getting less snow, when that precipitation comes down, it's coming down in the form of rain instead of snow. So when that happens, when there's heavy rain and when there's flooding, mold follows, because any kind of a porous surface that's wet can grow mold pretty easily, and that triggers asthma and allergy symptoms. But also we know that mold can cause asthma in children, and there was some research that was done where a group of kids were followed from birth to age 7, and when they were 8 months old, the air samples were taken from their homes, and it turned out that the kids who had the highest levels of mold in those air samples when they were babies had the highest rate of being hospitalized for asthma before the age of 7. So with all this, it's not really surprising that rates of allergies and asthma have tripled since the 1960s. And that could be due to a lot of things, and probably there's more than one thing contributing. But the reason that we think that a lot of it is due to climate is because Quest Laboratory, which is a large commercial lab that processes blood tests from doctors' offices and hospitals all around the country, decided to do a look back at 4 years of allergy test results. And what they found was that there was a 12 to 15% increase in positive test results for mold and ragweed, which is a pollen, and that the results for other kinds of allergens, things that cause allergic reactions, either the percentage stayed the same or it went down. So wildfire smoke was another thing that someone brought up about how climate affects the air. And the most dangerous part of wildfire smoke are very, very fine particles called fine particulates. And they are not only inhaled into the lungs, but they are so small that they then pass into the bloodstream where they cause inflammation. So when there are wildfires, we see more people in the emergency room with asthma and who have other lung problems, and with pneumonia also. And we also see more people having strokes and heart attacks and worsening of heart disease. The other thing that we've found out, and this is from my home state, California, some research that was done on the consequences of the big fires we had there in 2003, was that pregnant women who are exposed to wildfire smoke give birth to babies who have lower birth weights. And it's not a lot lower, but if somebody's already sort of marginal in their birth weight to begin with, this could be enough to put them into a category where they would have a higher risk of crib death or other kinds of newborn complications. So it's sort of like as if a pregnant woman was smoking, except she's just breathing the air in her community. The fire doesn't have to be where you are in order for you to be affected. This is from a NASA satellite picture of fine particulates from a fire in New Mexico that tracked all the way up to Denver, Colorado. Dust storms is something that I don't believe you're experiencing here, but in California again and in Arizona, we're having an increase in dust storms because we're having a near constant state of drought, and there's less vegetation to hold the soil in place. And this is a mile-high dust storm coming over the city of Phoenix right here. The dust has in it a number of things. It can have bacteria in it, it can have heavy metals, it can have pesticides. What we're seeing in Arizona and California is an 800% increase in cases of a kind of pneumonia that's caused by a fungus that's inhaled with dust. And for people who are young and healthy, most often it's something that goes away on its own, kind of like a walking pneumonia. But if you're older than 55, black, Filipino, diabetic, or have an immune system that doesn't work as well, or you take medicines that suppress your immune system because you have something like rheumatoid arthritis or something, then that fungus can spread through your whole body. And we have medications that can kind of control it, but not get rid of it completely. And so there are people that are dying of this. And in the Central Valley of California, they've had to evacuate about half of the prison population from the South Central Valley because they were in those groups that were vulnerable to have the fungus spread throughout their system. And so many people were getting sick and dying. This is another concern about dust storms, and we don't know if this is a problem or not, but I'm a little worried about it. Erionite is like asbestos. It's a mineral that comes from rock that's formed from volcanic ash. And just like asbestos, it causes a rare kind of cancer of the lining of the lungs called mesothelioma. And we found out about that because there's some villages in Turkey where they have that same kind of rock, and they built their houses out of it, and about half the people in those villages died of this very rare kind of cancer. It turns out they also had some genetic things that made them more susceptible, but even if you expose experimental, like mice, to erionite, they develop these cancers at a higher rate than if you expose them to asbestos. So we have erionite here in the United States. We have some in Montana. There's some in Washington, although it doesn't show up on this map because it's an older map, but it's the only one I could find. And part of the concern is that some of the same areas that are having these epidemics of valley fever and these dust storms also have a lot of erionite. Nobody's gone and taken samples of the dust storms to see what's in there, although I did find when I did a literature search that there were, somebody did do some sampling of air in some farm fields, and they could see erionite fibers with an electron microscope. So So we wouldn't know about this for another 30 years because that's how long it takes between when you breathe in the fibers and when you get the cancer. In cities and in places where there's been a lot of mining and contamination, another thing that we're seeing is just from dust. Not with dust storms, but just when the summers are hot and dry, dust goes into the air. And when that happens, also if there's lead, then the lead goes into the air. We're not talking about lead from paint chips in houses here. We're talking about our legacy from using lead in gasoline. And so places where or where it's been used in industry or mining or something, but places that have had a lot of traffic, a lot of our cities, for example, have lead in the soil. And so the hotter and drier the summers are, the more of that lead gets suspended in the air. And so researchers have gone in and measured that, and then they've looked at the results of blood tests of children, and there's a seasonal increase in the lead in the air and the lead in children's blood. So what you're seeing where it goes up and down is up in the summer, down in the winter, up in the summer, down in the winter. So what's the consequence of that? This is not as high lead levels as you get if you eat paint chips. But even low levels of lead cause brain damage. And this is showing you some results from standardized test scores and linking them with the lead levels. And this way we're looking at over 20,000 students in Detroit Public Schools. And you can see that the kids who had the higher lead levels, the 8s and the 9s, had the most test scores that were either not proficient or only partially proficient. And the kids who had the lower lead levels did better. So this is not reversible. Once you've got that lead in your system and it's done that to your brain, you can't undo it. And this is not like a house where you can go in and fix it. If our climate is going to be hotter and drier, then kids will be breathing more lead. Okay, here's another case to wrap your brain around, and George is not going to say anything. This is a mid-sized city where the public health officer started getting phone calls from pharmacies because so many people bought diarrhea medicine that they couldn't keep any on the shelves. So they thought there must be something wrong. By the time the cause was found and taken care of, 400,000 people had become sick.
Have you heard yet?
No, but something sort of like that.
Sick, contaminated city water?
Yes, absolutely. That's what happened. Now, how would climate do that?
Storms.
Okay. Heavy rainfall, yeah. So this was the city of Milwaukee, and what happened was this happened after a record rainfall, and it was an outbreak of something called cryptosporidium, which causes vomiting, diarrhea, abdominal cramps, goes away usually by itself after a week or two. And I'll skip that one. So what happens is that Milwaukee has a kind of sewer system that is pretty common in the U.S. About 700 cities in the U.S. have this. Big cities like New York and small towns like where I come from. It's called combined sewer overflow. And combined means that the same pipe that carries away raw sewage is also supposed to carry away rainwater. And overflow means that if you're having heavy rainfall and there's more stuff going through that pipe than your sewage treatment plant can handle, its system is designed to overflow and dump that mixture of raw sewage and rainwater into a river, lake, or harbor. And the best description that the most vivid description that I've read of how much, I mean, we're talking tens of billions of gallons of raw sewage a year. The best description I heard is that it's enough raw sewage to keep Niagara Falls flowing for 18 days.
Oh, God.
Yeah. So I put the Allegheny River up here because this is one of the areas of the country that has the highest number of these sewer outflow pipes, and those are people swimming in it. So what happens is that in Milwaukee, anyways, they also get their the same lake that it's one of the Great Lakes. My geography's bad. Michigan, where they were dumping their sewer overflow, is the same place they get their drinking water. And they had a little failure in one of their drinking water treatment plants, and that's how the cryptosporidium got in and was delivered to those 400,000 people. Cryptosporidium is not killed by chlorine. So this is also an issue. Just the inadequacy of our sewer treatment systems. When sewers back up, and that nice fountain there that's from Duluth, Minnesota, is raw sewage and rainwater coming up through a manhole. This is not an infrequent occurrence in towns across the U.S. And the picture on the right is what happens when the flow goes the other way. And this was Hurricane Sandy. When the storm surge went through those outflow pipes, the outflow pipes became inflow pipes and blew that sewage up spewing out of sinks and toilets in people's houses. And this is 5 weeks later because it happened in so many houses that they just couldn't get it all cleaned up quickly. So aside from the different bacteria that can give you diarrhea, hepatitis is another virus that is transmitted by sewage. There are other things are also in floodwaters. There's industrial chemicals, and our water treatment plants are frequently become inoperative when there are floods because they're inundated and they're contaminated by the floodwaters. And sewage treatment plants also overflow and adding more sewage to the floodwaters. So this is a study that was done where there was a model predicting how many kids would get sick with diarrhea based on the amount of rainfall. And this was a Midwestern city, and that's the blue line, and then the black line are pediatric visits to emergency rooms for diarrhea. So you can see that they match up pretty well, and the majority of the water contamination, drinking water contamination cases that happen in urban watersheds happen after heavy rainfall. So our water treatment systems, our sewage treatment systems are not designed for the kind of heavy rainfall that we're seeing, and they're not secure enough to protect us from disease. So of course the other thing is that this stuff is getting dumped into rivers and oceans where people go for recreation, and that has resulted, it's cost a lot of money because public health departments have to monitor. They've got to take water samples all the time. They've got to close these beaches when the counts of bacteria are too high, and even with all that, the numbers of outbreaks of infectious diseases from recreational water exposure have been still increasing. So the other thing that's in floodwater is, I don't know if I have a slide on that or not. I guess I don't. But the other thing that's in floodwater is it can be diseases that are not human diseases, but animal diseases that can be transmitted to humans. And if you live in an area where there are, in cities, rats can carry diseases, but also all the small, the raccoons and the possums and the foxes, also livestock. And we're seeing this more and more in dogs. The most common disease is called leptospirosis, and it causes an illness with a fever, but also then it inflames the liver and then it shuts down the kidneys. It's treatable with antibiotics, but we're not used to looking for that, doctors here. And rates, it's still not very common, but the rates have been increasing. And this happens because when this is transmitted, the bacteria come out in the animal's urine, and when you've got heavy rainfall and that urine gets washed into some water where people are going to go paddling or swimming, then those bacteria live for about a month in there, and if people go in and they have a little cut, or the water gets on their mucous membranes, their eyes, their nose, their mouth, then the bacteria enter and cause leptospirosis. Now, another effect on water has to do with this is kind of a combination of heavy rainfall and warmer water temperature. With heavy rainfall in agricultural areas, you get more nutrients washing into lakes and rivers. And then when the water's warmer, that between those two things, that promotes the blooms of harmful algae, and blue-green algae in particular. So this is a huge bloom of blue-green algae in Lake Erie. And blue-green algae makes a toxin called microcystin, which affects the liver. And if you just swallow a little of it, you might get some diarrhea. If you drank more of it, you could have hepatitis. And if you were exposed to it on a regular basis, you could get liver cancer. And microcystin is commonly found in lakes in the U.S. now, not only when you see the lovely green scum, but also about a third of the time in the Midwest where they've looked at it. I haven't read anything about them looking for it out here, but about a third of the time it's there even when the green scum is not. And it's not destroyed by boiling, and you can't remove it with a filter. So if you are an outdoors person and you go backpacking, if you see even a little bit of this scum, you really probably shouldn't be drinking that water. The most danger is to children and dogs, because they're smaller and it takes less toxin to make them sick. And in our area, we've had a number of dogs die from that. And they just go have a little drink, and within a few hours they're dead, because where at the water's edge, where the algae kind of bunches up and crusts up, the levels of that toxin can be about 1,000 times higher than they are out in the middle of the lake, and that's the area where the dogs and children are. So here's another case. This is a man who started feeling unwell about 30 minutes after dinner. And he had some tingling around his mouth and some feeling of heaviness in his arms and legs. And he thought maybe he was having a stroke. So being a man, instead of calling 911, he decided to drive himself to the emergency room. But by the time he got there, he was too weak to get out of the car. And he was too weak to shout for help. But luckily, somebody found him. Because within an hour, he ended up completely paralyzed and had to be on a ventilator to breathe. He did recover completely. So what happened to him?
Food poisoning.
Some kind of food poisoning. What kind of food? What do you think he had for dinner?
Oysters, seafood.
Yeah. This is paralytic shellfish poisoning, and just like we were talking about the blue-green algae in freshwater, with the oceans being warmer, we're seeing more and more blooms of harmful algae in the oceans, and they tend to make toxins that affect the human nervous system. So this is the one called paralytic shellfish poisoning, and it's oysters, mussels, clams, and it depends how long after the bloom is. I don't know how I say that. Let me back up. Different kinds of shellfish hold that toxin for longer periods of time. So we started our trip in the San Juan Islands, and you can go on the health department state health department website for any coastal state, and they'll show you a map of all the areas that are closed to shellfish collection because of these toxins, and pretty much all the San Juan Islands were redlined. not for every kind of shellfish at that point, but for butter clams and varnish clams, because those clams can hold those toxins for up to a year and make people sick if they eat them, even when the bloom is long gone. And this is a graph just showing the increase from the 60s to now in the numbers of reported shellfish poisonings. And this is just showing you locations of those algae blooms and toxins where they've been found in the United States. Oh, okay. So that was the map of the San Juan Islands. And they, at that time, had 118 public beaches that were closed because of marine biotoxins. So we're talking about food and the effect of climate on food. You know, one of the biggest effects just has to do with access to food, because when you have serious drought years like we've had for the last couple of years, then crops fail, then the price of food goes up. And the price of food the consumer price index for food has gone up by at least 13%. They haven't have the data out for this last year, but for the 2 years before that, it went up 13%. And the first things that the price goes up is always meat, poultry, and dairy. So we have a lot of families in the U.S. who are sort of on the edge of whether or not they can afford to put 3 nutritious meals a day on the table. We call those families food insecure. And when food insecure families have to deal with a 13% price increase, that means that they're going to be nutritionally affected. And when families who are on the edge of being food insecure have to deal with that, then they go over the edge and become food insecure families as well. So that has health consequences. For children, kids from those families have higher rates of hospitalization and about 8 to 11 times higher rates of iron deficiency anemia. That's important because iron deficiency anemia means that there's not enough red blood cells, and that's what carries oxygen to the brain. So kids who have that do poorly in school, and they end up with lasting learning problems, even if you diagnose and you replace the iron. Adults from those families tend to fill up on empty calories, and so they have higher rates of obesity and diabetes. So, but we also, I've got the picture of the fish kills up there because that's another thing that happens with those harmful algae blooms. They suck up all the oxygen in the water and result in fish kills. And increased water temperature also is threatening some of our native fish, the bull trout and the rainbow trout and salmon. And that's a particular impact for native peoples who depend on those, not only for nutrition, but also for their spiritual and community life. Vibrio is a kind of bacteria that lives in seawater, and when the water's warmer, it multiplies faster, and so we've had a big increase in Vibrio infections. And this is a bacteria that can be killed with cooking. So this happens mostly when people eat raw oysters, raw shellfish. So it's a bad idea to eat raw shellfish in the summertime. Pretty much I wouldn't do it. And there's 2 kinds of Vibrio infections that we see here. One is just kind of a vomiting and violent vomiting and diarrhea, and the other is where the bacteria goes straight into the bloodstream and starts attacking the vital organs and puts people into shock and is the most common cause of death from consumption of shellfish. So back on land, we've got a problem with toxin in corn. When corn is grown under drought conditions, it gets infected by a fungus, and that fungus makes a toxin. It's always these bad funguses, isn't it? They're bad. They make toxins. This one makes a toxin that causes liver cancer. And around the world, in Africa and Asia in particular, where there is a lot more drought and crop stress, this is one of the major causes of cancer, is liver cancer. Oops. Sorry, I lost my mic. So for the last 2 years, there have been in the Midwest and in the eastern part of the country and a little bit in the West, much higher levels of this toxin being found in our corn crops. So all the places that have those those green diamonds are places where aflatoxin levels have been high in corn crops. And the Food and Drug Administration has some limits on how much aflatoxin can be in food for human consumption, in food that's fed to dairy cows, because the aflatoxin will come out in the milk, and also food that is fed to that is fed to livestock. But what they did, because it would have been so devastating to the farmers in those areas, is that instead of saying you have to throw away that tainted corn, they said you can just blend it with some corn that doesn't have aflatoxin in it and bring it down so that it's just below that legal limit. But aflatoxin is another one of those things where there's no safe level, for real. And so if you double or triple our exposure to aflatoxin, then we're going to see a corresponding increase in liver cancer.
Is there any correlation with GMOs and this particular?
I don't know. I don't know the answer to that. The thing about aflatoxin is that by itself it can increase your risk of liver cancer from 3 to 7 times. But if you have anything wrong with your liver, if you have any kind of chronic inflammation in your liver to begin with, if you're a big drinker, if you have hepatitis C, then aflatoxin can increase your risk of liver cancer 60 to 100 times. So we're having right now, the thing that's worrying me is that we have an epidemic of this chronic liver inflammation from people being overweight. It's called fatty liver, and somewhere between 30 and 40% of the U.S. adult population has fatty liver. And if you add aflatoxin to fatty liver, you are just it's like throwing kerosene on a fire. And there were some studies that were done because this has typically been like a third world problem, and we've said, oh, we don't really have to worry about it here. But in southern Texas, they have even higher rates of liver cancer than in the rest of the U.S. Liver cancer is now the fastest growing cause of cancer death in the United States. Not probably because of aflatoxin at this point, probably because of hepatitis C and all of us baby boomers who did things we shouldn't have done, but it's a fast-growing problem, and because we're seeing people who have fatty liver who are getting liver cancer. And Latinos and Native Americans have higher levels than the rest of us do. Partly probably because they have more diabetes, and it all kind of comes in a package, that high blood pressure, obesity, high cholesterol, fatty liver, it sort of all runs in a bunch. But the other thing is that Latino people, at least in the Southwest, eat more corn. So there was a kind of a pocket of very high levels of liver cancer, and the researchers went in and they did blood tests to see if they could find aflatoxin in people's blood, and they found that 20% of the people that they screened, just random people, had detectable aflatoxin in their blood, and that the more corn or rice people ate, the higher their aflatoxin levels were. So people who eat a traditional Mexican type diet, which a lot of people in the Southwest do, would be getting a lot more exposure to that aflatoxin than people who don't.
Does that affect blue corn as well? Do you know?
I don't know. Sorry. One of the great things about being a generalist as a doctor is that you can say, I don't know, like, all the time. So insect-borne diseases is another thing that we're seeing more of. And West Nile virus is a good example of that. West Nile virus is a virus that's carried by mosquitoes. And it causes, in many people there are no symptoms at all, but in about 1 out of 150 people, that virus invades the nervous system and causes either an encephalitis, a brain inflammation, or a myelitis, which is like polio. It's an inflammation of the spinal cord. And a lot of people who get that invasion of the nervous system end up with lasting nerve damage. So we first got West Nile virus in 1999, and in 5 years it had spread all the way across the country. And mosquitoes and climate have been implicated in the speed of the spread. Because when the weather is warmer, the mosquito breeding season lasts longer. Mosquitoes come to maturity more quickly, and if they're carrying a virus, then the virus multiplies more rapidly as well. So you get more mosquitoes who are more likely to bite, and if they bite, you're more likely to get an infection. We're also seeing increased rates of other diseases that are carried by mosquitoes. There's other kinds of encephalitis, brain inflammation in the U.S. So the eastern equine is one that was in the news a lot last summer, also carried by mosquitoes.
Do you know if there's been a higher rate of cellulitis due from insect bites?
No. No, I haven't read anything about that. And cellulitis is a bacterial thing. The mosquitoes wouldn't carry it. I mean, this is sort of what we're talking about is where the only way that you can get this disease is if the mosquito that has that virus in it bites you. Whereas cellulitis is a bacteria that could,
Right, I was
yeah.
just wondering if there's been a rise in that.
Not that I know of, actually. I think it's probably going down here. We had a lot of it back when we had a big rash of resistance to antibiotics and methicillin-resistant staph infections and a lot of cellulitis, and it seems like those numbers are actually dropping now that health providers are prescribing more carefully. But one of the diseases that we are seeing increasing is dengue fever. And this we had in the U.S., in the southern U.S. It was eradicated, but it's back now. And we've had 7 outbreaks in Texas, 1 in Hawaii, and 3 in South Florida. And this is just showing you the return of dengue. And everything that I told you about the effect of increased temperature on mosquitoes holds true, but also the mosquitoes that carry dengue don't survive over a freeze. And so now that there are warmer winters, the area that those mosquitoes can live in has expanded. This is a truck in South Florida that's spraying insecticide, and this is a child who has hemorrhagic fever, which is a variation of dengue. So the first kind that someone gets a dengue infection, they get something which the folk name is breakbone fever, and you get a high fever and severe pains in your arms and legs. But the second time, if you get dengue, then you have not only the infection, but you have your immune system reacting to the infection, but instead of just attacking the virus, it attacks the person, and they lose their ability to clot blood, and they start bleeding, and their blood vessels become leaky, and fluid leaks into the chest cavity and into the abdomen, and without excellent supportive care, it's about 50% fatal. So when dengue cases started being found in Key West, Florida, the health department went around and did some blood tests to see the extent of it, because they thought maybe not everybody who got it went to the doctor. Or maybe the doctor said, oh, go home and take some Tylenol, and didn't diagnose it. So they did some random household testing, and they found that about 5% of the people that they tested showed evidence of a recent dengue infection. So we now have dengue's well established in South Florida now. We have our own strain of dengue that is genetically distinct from the ones in other countries, and you don't have to travel anywhere to get a dengue infection anymore. Well, maybe just to Florida or Texas, but not out of the country because it's back. So we're talking about environment. We're talking about a safe environment. And this is a girl who was displaced from her home by a extreme weather event. And what we see in the U.S. in terms of health consequences from displacement, the biggest thing is the people who have chronic diseases tend to have their diseases flare up or get out of control when they're separated from their medications and from their usual health care. And I was part of a group that went down to help people in Texas after Hurricane Katrina, and that's pretty much what I saw. It's not so much people were damaged by the hurricane, but it was, you know, diabetics without insulin, schizophrenics without their psychiatric medicine, people who were supposed to be on dialysis. You know, our medical system helps a lot of people stay alive and healthy who wouldn't be otherwise. And when all of that is suddenly taken away, then a lot of people get really sick. So the other side, of course, is that there are psychological consequences, and people who have experienced these kinds of extreme events have about a 30% rate of developing symptoms of post-traumatic stress disorder, which is the same kind of psychological problems that soldiers have when they have been in war. Because what it takes to develop post-traumatic stress syndrome is exposure to a traumatic situation that you have no power to control. So when we talk about people in the rest of the world, I mean, we are getting off pretty light. There are a lot of places in the rest of the world that are much more vulnerable to the health effects and other effects of climate change than we are here. And what that means is that there's going to be probably by 2050 about 200 million people who will be displaced from where they live, either because of sea level rise or crop failure or lack of water, various other conditions that make it so they can't stay where they are. And some of those people will be coming here. And these are poor countries for the most part. And when poor people migrate, they bring diseases of poverty with them. So a big concern in the United States is about tuberculosis, which is an infection of the lungs. And tuberculosis is treatable, but it takes about 6 months of medication to cure a case of tuberculosis. And if there are interruptions in treatment, then the bacteria can become resistant to the medicine. So if you came down with a case of active tuberculosis here in Missoula, probably a nurse from the public health department would come to your door every single day and watch you take your medication, because the risk of developing that resistance is so serious. But in poor countries, they don't have that kind of a public health system. They don't have those kind of resources, and so treatment gets interrupted a lot. And so they have what's called multiple drug resistant tuberculosis, where many of the medicines just won't work anymore. And we know already that immigrants that come from the parts of the world that are most vulnerable to climate change, which Asia and the Pacific Islands, for example, have higher rates of tuberculosis and higher rates of multiple drug resistant tuberculosis that they can bring with them here. Extreme heat, of course, is kind of the obvious consequence of global warming, and it can be extremely lethal. In Europe in 2003, there was a heat wave that killed 70,000 people, and it turned out that there was a kind of an undercount that was done at first from the medical records, but then when they looked at the undertakers' records and found out how many people had really died. In 2010 in Russia, they had a heat wave combined with a wildfire, and 65,000 people died. So these can be extremely lethal. Now, in this country, we have gotten better, at least in urban areas, about figuring out who's most vulnerable and how to sort of get to those people and try to offer them, you know, some access to cooling. But still, the highest number of people who die are people who are elderly, people who are low income, and people who live in areas where there's less green. You know, parts of the city where there's less greenery. Hand up there?
Yeah. What do people die from in heat waves? Is it
Oh, good question. You know, some people die from heat stroke and you know, sort of the classical thing, or dehydration. But a lot of times it's people who have chronic diseases, and they die of that chronic disease that they have. And there was a big study that was done last year, I think, and they looked at people on Medicare, and they followed people from a number of different cities, every single person who was discharged from the hospital with a heart attack, congestive heart failure, diabetes, and chronic lung disease, and followed them to see how long they would survive. And what they found is that every time the temperature, and they actually controlled for, they discounted all the heat waves, they discounted ozone levels. I mean, they kind of took into account all those things so that they wouldn't show up in the results. And every time the temperature went, the higher it was from the average temperature, the more people died. And they figured from their calculations that about 10,000 people die a year from increased temperature. Medicare patients. So that's kind of, I think, a pretty good summary of what are the health effects of climate change. I haven't talked to you about everything, but I've tried to give you kind of examples from each category. But then there's another side to this, and if you look at these two pie charts here, they look kind of similar. And I don't know if you can't read the small print perhaps, but the one on the left are the sources of U.S. greenhouse gas emissions, with the largest ones being the generation of electricity, which is the big blue one, and the transportation, which is the red one. On the other side, we have the top 10 causes of death in America, and the big blue wedge there is heart disease, and the red wedge is cancer, and then comes stroke and chronic lung disease. And the reason why these pie charts look so similar is because when you do the one, you get the other. So how does that work? Well, first of all, we're spending more and more time in our cars. We're driving longer distances, and we are moving around under our own speed less and less. That's what the trend has been. And if you compare America with other developed countries, we are at the absolute bottom in terms of walking and cycling. And what we know is that a very large percentage of our chronic disease epidemic is the result of physical inactivity. About a third of all obesity, heart disease, diabetes, and many common kinds of cancer are the result of physical inactivity. If we were moving around, we wouldn't be getting as many people coming down with those illnesses. And of course, we're causing air pollution. You know, we talked about particulates from fire, and we talked about ozone, but we also get particulates released when we burn gasoline, when we burn coal, and that causes air pollution and the same consequences in terms of lung and heart disease. Another thing is that our agricultural system is heavily weighted towards growing corn to feed to animals, and that is not good for the environment, because a lot of those animals are contributing methane to the atmosphere, which is 20 times more powerful greenhouse gas than carbon dioxide. But it's not good for us either, because we know that the people who eat the most red meat in the U.S. have the highest rates of diabetes, heart disease, and cancer. So if you had to sum it up in one slide, I think this would be it. If our health is not something independent of the place that we live. You cannot guarantee your good health by taking vitamins, by exercising, by going to the doctor, because we depend on that air, that water, the food, and the safe environment for our good health. And if climate is changing and that's polluting the air and contaminating the water and putting toxins in our food and making it too hot and too full of insects that are carrying disease, there's no way that we can be healthy. And there's no way to deal with it other than to address the root cause, which is climate change and the burning of fossil fuel. So how are we doing on that? Not very well. This is from a website that you can go online to, and it keeps track of what temperature we'll be ending up at by the end of the century. And the yellow line is if we continue business as usual. The blue line is if every country that made promises to lower emissions kept all of their promises, which some of them are not. And the green is actually the goal that we are already past, that rapidly receding goal. So, and the numbers, the big numbers are in centigrade, and the little numbers are in Fahrenheit. And oh, it's pretty blurry, but basically, you know, this was 8.6 degrees was where we were going to end up in 2010, and 8.9 degrees is where we're going to end up now. And the impact of countries' promises to lower their emissions has also gone down, and our country is largely responsible for that because we're the second greatest emitter of greenhouse gases, and of the top 10 emitters, we have the highest per person carbon footprint. So other countries say, why should we do that if the United States doesn't do it? So, so a lot of this is our fault. It also means that we have a great opportunity because what we do will make a huge difference in the outcome. But this is the bottom line. If the developed countries don't cut their CO2 emissions in half by 2030, then by the end of the century what we're going to see is somewhere between a 7 to 12 degree increase in temperature, and essentially irreversible. So that's the bad news. Here's the good news. This is not a hard problem to solve. And I want to go back to the ostrich just for a minute, because there's one kind of denial that is really common among people who are very well intentioned and who care about the environment, and it's called tokenism. And what that means is, you know, it's like if you run a company and you hire a black person or you hire a woman, but you don't pay them as much as you're paying the white man who's doing the same job, and you don't stop people from making racist or sexist remarks. So you haven't changed, you haven't stopped racism, you haven't stopped sexism, but you can look at that person and kind of pat yourself on the back, say, I'm a good guy, I'm a multi-opportunity employer, or whatever they call it. And for climate change, you know, the same thing, unfortunately, is true. So the reality is that we have 17 years to cut our carbon emissions in half. And nobody buying a Prius or riding their bicycle or putting a solar panel on their house is going to get us there. There's only one way to get there, and that's if we all do it together. And that, I mean, that's just the truth. So this prescription for climate action, which is developed by a group of doctors that I belong to called Climate 911, is not for you to do at your house. This is for us to do in our house. And we can do some of it here. I'm not saying that nothing matters, but in order to get to that goal and to make a significant dent, we really have to do this as a country. So what do we need? We need active transportation. We need people to get out of their cars and walk and bike for their short trips. And what does it take to do that? Well, you have to have communities that are designed so that stores and schools and work are within walking and biking distance, right? You have to have safe places to bike and walk, and you have to have some public transit. And Missoula is a star for most of this. If we did it, this is the benefit that we would get in terms of chronic diseases. So we need to be maximally energy efficient, and this needs to come from the highest level. I mean, we need to be able to have every home in the U.S. should have an energy retrofit, and you know, not every single thing that you can do, but basic insulation and stopping of leaks. Our vehicles need to be as fuel efficient as they can be and more electric than fuel burning. We've got to make this transition to clean electricity generation now, because if we keep going, once you've invested in in fossil fuel for electricity, then that money's spent, and you can't turn around and do something different. And we are about 85% locked in terms of our electricity generation capital investment into carbon now. And by 2017, it would be 100%. So we've got to make the turn now. Of course, we can't export coal, because if it's burned anywhere on the planet, it's going to do the same thing to the climate. We don't want to have new coal plants because, like I said, if you invest in the wrong thing, then you don't have money to invest in the right thing. And we need to have carbon tax or a cap and trade or something that puts the cost of that dirty energy up front, because we're paying for it now. I mean, the average cost of a gallon of gas is about $15 a gallon, but we pay for some of it at the pump, we pay for some of it with our health insurance premiums, we pay for some of it in our taxes for fixing the damage from all this extreme weather that we have, and some of us are paying with our lives. So if we did that, we would experience some immediate benefit, because air pollution would improve. And we know this from the Olympics, both in Atlanta and in Beijing, where they restricted traffic. They had immediate decreases in emergency room visits for respiratory conditions because the air cleared like that. So we also need to change the way that we subsidize our farmers, so that we're paying them to grow what we think people should eat to stay healthy. And if we did that, we would have a huge benefit in terms of decrease in cardiovascular disease, diabetes, and cancer. So I'm going to skip that one and talk to you a little bit about what the work is that I'm doing, and then Georgia is going to talk about what's going on here and what you can do locally. So I'm working on organizing health providers because I think that if we can reframe this as a health issue rather than an ideological issue, we may be able to get some movement in Congress. And we have to have movement in Congress in order to get these big jobs done. So as I go across the country, I'm collecting endorsements from health professionals of that prescription for climate action. And then when we get to Washington, D.C., we're going to have a lobby day, and other doctors and nurses are coming out to help me, and we're going to deliver prescriptions with the name of the congressperson at the top and the signature of the health professional at the bottom to all of the representatives of the people who do the endorsements. So I need some help getting those endorsements from Missoula health providers. And I'm going to pass out some cards, but I'm hoping that you all can either do work among your colleagues or doctors and nurses and other health people that you know to see if you can get them to go online. It takes just about a minute to do this endorsement. And we're also welcome any of you who want to come to the lobby day and help us deliver prescriptions. That would be great too. So that's what I'm up to. And Georgia, do you want to talk about?
Sure.
Yeah.
When is that lobby day?
October 31st.
Okay. All right. Let me just say, this will just take a few minutes, and Nick may want to jump in, but some of us and some of you in the room have been involved in the coal issue, because as probably everyone in the room knows, that the #1 producer of CO2 globally is the coal issue. And in the United States, we have been actually doing much, much better because coal is such a dirty industry. So we have been decreasing our coal consumption. But there are certain states, Montana is one of them, the Saudi Arabia of coal, that we're sitting on billions of tons of coal. And so the plan is to mine it and ship it to China for their combustion. And I don't really know the dollar figure on this, but I do know that we will be paying for this with our lives. Even on just a very kind of ordinary level, the hazardous air pollutants from burning this coal in China and the mercury come right back to the Pacific Northwest in less time than it takes to ship it there. And of course, the elephant in the room is climate change. And we're talking about billions of tons of CO2 being burned from Montana coal. And as you know, Schweitzer did sign those leases for the coal companies to mine that coal. Right now, the Montana DEQ is doing their research to see what will be the environmental damage. But when I talked to the DEQ a few months ago, it was very clear that they really don't have within their scope the human health implications. And often, you know, they're just looking at the environmental quality right in that particular area, and they're not looking at climate change. And we know that coal strip in Montana is the 8th largest greenhouse gas emitter in the United States. So as we're phasing out coal use in the United States for very good reasons, we still want to mine our coal and ship it to China. And so we have one chance. So we'll see what the DEQ says, but their hands may be tied. They're feeling very frustrated about their ability to stop this, even though it's going to be potentially the tipping point as far as climate change. But this is one of the few cases that this has to actually go in front of the land board for a second time, even if the DEQ can't stop it. And so right now, it's very important that everyone contact Bullock ASAP, and our Attorney General, I'm spacing out on his name right now. Yeah, and he's, you know, he's, when I've spoken to him, he's very pro-coal. And I think Bullock is our best bet. You know, he's one of the 5 on the land board. But this is huge because I think we have an extremely limited time, maybe just the next 6 months, at the most a year. And I can guarantee you that once that coal is mined, it's going to be shipped. So even if the communities, you know, even if Missoula and Bozeman say, not in our backyard, we don't want this shipped in our backyard, which we don't. And that's another whole slew of health implications and terrible problems. But even if we should stop those trains, they're going to get it shipped to those ports once it's mined. And it's really important that that coal stays in the ground. And so we have this very limited window of opportunity here. And so at least, you know, contact Bullock, but really pay attention to this issue. And Nick is working very hard with Blue Skies. I know we're going to be part of a panel discussion in Helena next week on this. But Nick, is there anything else that you want to say?
I think you said it really well. I'm just, part of it too is, I mean, we have a relatively new governor. Bullock has been in office less than a year now, and so it's really especially important right now that he start to hear from people, you know, early on during his time as governor, because he's going to be the one overseeing the DEQ as it does this review. He's the one overseeing various other state agencies that might have influence over this. And so, yeah, if you can, you know, go on to, you know, just do an internet search, Steve Bullock, you can find his email address, contact information, and let him know that this is something that's important to people in Montana, because he's also coming under a lot of pressure right now from the other side, from the coal industry. They really want him to green light these projects, and so he needs to know that there's people watching this who don't.
Right, last month I met with Tester at Baucus's office in Washington, D.C., and they said that the coal companies are coming every week now. And they're under tremendous influence.
And it's really important to insist that a proper environmental review has to include the health effects of climate change. That to not look at climate change as the environmental consequence is not to be a complete environmental review. And so that's an important point to just insist on.
And the DEQ felt that the only hope at this point was to have the citizens of Montana really rally, and so that's us.
Did you say this is going back to the land board?
It is.
So we should also contact them.
So all 5 of the land board members, Juneau has, I think, been the only one who's been very strong, very steady, saying this is a very bad idea.
Yeah, and it's and she needs to hear from us too.
Yes,
she needs
she's
to
done
hear
a
that,
lot.
you know, people appreciate her
Yeah.
taking that stance on that, because that was, I mean, she really kind of went out on a limb politically to do that, and so if we can tell her we appreciate that, that's important as well.
So yeah, Google the land board and everyone on that land board. If they could hear from you, it's going to make a big difference.
It's just 5 people.
It's just like,
It's the governor and Denise and the Secretary of State.
yeah,
Monica Lindeen.
right.
Do you want people to call or write or email? What do you want them to
I think
do?
you should do everything.
Oh, all of the above.
All of the above. I'm not sure politically what's going to be the most.
Yeah, I mean, the general rule I've always heard is the single most effective thing that you can do is write a really personalized, detailed letter. After that, a phone call is the next most effective, and then, a form email is kind of at the bottom.
2 years ago, I completed 2 years with an advisory task force under Schweitzer. And that created 354 points in all sectors of Montana's economy for reducing carbon dioxide emissions. This plan is called the Montana Climate Action Plan. It was sanctioned by Governor Schweitzer, who ended up adopting 5, the 354 recommendations. That recommendation plan has been thoroughly vetted by all sectors, and it keeps money in the state, radically reduces our carbon footprint, re-energizes Montana's economy. It's already there. It's on a DVD, you can access it on the web. Bullock needs to see this, because it was under Schweitzer, only adopted 5.
5 out of 354.
And he never really pushed for any adoption. Bullock is much more sympathetic. Remember, Schweitzer is the one that gave us clean coal.
Right.
But Bullock is the one that can actually use this, in Firefox, can actually use this to benefit the state in a huge, huge way. It's already been done. There's been tons of work and data analysis in all sectors of the state of Montana, so it's there. Now it has to be put in front of Bullock with enough power and pressure to see if he can adopt more than the 5. We also have Tracy Stone Manning now at DEQ.
Exactly.
It's a powerful voice for moving this agenda forward. You don't have to reinvent the wheel.
Right.
We spent a ton of time doing this. So it's already there in all sectors, agriculture, transportation, industrial, power generation. And it just needs to be brought up, and Montanans win in every sector that adoption takes place.
Say what that's called again?
It's called the Montana Climate Action Plan.
Is it
A lot
online?
of work on it. DEQ has a copy.
Okay.
It's online. Yeah.
So then when people contact the land board, they should also be referring to this particular body of work?
Yes, any of the sectors you can bring up and just say, what about this, what about this, and just put it all out there. And just to let you know, when the land board last voted on, this is coal leases on Montana land, Juneau was the only one that voted against it. The other 4 members voted to create an excise tax, so we get 5 cents every ton
Right.
of coal
Goodness, yes.
dug up and exported. 5 cents a ton. As an excavator, as a general contractor in Missoula, I pay $12 a ton for gravel in Missoula, right here. 5 cents seems like an absolutely absurd legacy to leave the state.
Because someone's making a lot of money from it.
There's
Oh,
a lot.
yeah.
Yes. And it's not.
And all they have to do is finish that rail link over between Miles City and closer, so watch that one. That's going to be a big one. One more transportation link, and then it'll be an easy slide. But Montanans really have a lot more at stake here. Not just the health of the
Absolutely.
state, but the health of the individuals. I appreciate your time
Yeah.
and letting us know what the overall health effects are.
I mean, I think it's pretty clear that the solutions exist and they're not complicated. It's a lack of political will, and our government. If our government doesn't listen to us, we have to take back our government. And it's. There's really I think there's been so much interest in doing all the things that we can do personally, because none of us have really wanted to take that particular bull by the horns. But it's really a question of is the planet going to survive or not? Are we going to survive or not? And there's really only one way to do it. Yes.
Well, actually, when you come right down to it, it is a massive, massive problem because of the entrenched realities that we're up against. And it's universal. One of the problems is that nobody talks about population. And of course, population, as it grows and grows and grows, contributes to this. And the higher population growth rates that you have, the more that there are aspirations of many more people to burn fossil fuels and to gasoline and all the rest of it. Higher standards of living are based upon energy conversion and consumption. So, you know, it really is a massive problem. I'm completely overwhelmed by it all. I just don't know. I mean, yes, we gotta go to Washington and bang on the doors of those people who can't get anything done and tell them to come on and get something done. But it's such, the entrenched reality of the problem is so massive that it's really, I mean, I'm not trying to be, negative about it, but still, I mean, I write my letters too. I write my letters too, and I just don't know where to start and how to do it.
Well, I think we have to start with our own country. And I mean, as far as population goes, what we know about population is that when women are educated and when standards of living rise, then families have less children. And so, as we have to, it's not so much about, it's really about trying to have a world that's more fair and a better quality of life for everyone. But right now, we're sort of the international party pooper when it comes to climate accords, and it's creating a situation where the logjam on the international level is because of us. And so if we don't move our country, then the rest of these things won't happen. And the other thing to point out, of course, is that because we have such large carbon footprints here, a baby that's born in the U.S. causes more climate change than a baby that's born in China or India or one of those places. So I think the first thing we have to do is look to our own situation, and it's overwhelming if you can't sort of set priorities and figure out what lever do we need to pull, where do we need to make this thing move. But I think we can set priorities and figure out what's essential, what's most effective, and go after them.
And of course, the situation with the coal in this state is really...
Absolutely.
It really is a monumental issue.
Is there a plan anywhere to attempt to affect change of lifestyle and value system amongst the political will folks?
Well, what I'm going to talk about that from the perspective of being a doctor, because that's what I know. And what we've learned in medicine is that, because we work now not so much with people who have one little problem and they come in and we cure it and they go away healed. We work with people who have chronic diseases and they need to make changes in their lifestyle, right? But what we've learned is that lecturing at people and telling them what to do is completely ineffective, but that we are very much creatures of our environment. And so, if you could tell people to exercise more, it doesn't do anything. But if you put a bike lane on someone's street, it increases the chance that that person is going to ride their bicycle to work. You can tell people to eat vegetables till you're blue in the face. They're not going to do it. But if you bring a farmer's market, or or even put a supermarket in a poor neighborhood, you can increase vegetable consumption 30%. So what we need to do, and this policy package that that the Climate 911 is pushing, are to set those kind of policies in place that make those environmental changes. Because we're really just responding to, we're making the best choice that we can at the time given the situation, but we can change a lot of those things.
One thing that Missoula is a transition town. I mean, they have that official designation now. And Wendy's probably very familiar with the transition town movement, but it's communities who are committed to getting off of fossil fuels. And so there's a group of people who have been meeting regularly. If you Google Transition Town Missoula, and they talk about what it will take to help us get off fossil fuels, to actually have neighborhoods where people share a lawnmower, or share a car, or at least have some neighborhood store to go to, or ways that we can work as a community, as neighborhoods, to get off fossil fuels and be happier. You know, instead of everyone running around trying to make more and more money, it's a way to transition into a greater state of happiness, that there will be a future for our children. So there are very committed people, and Missoula is very strong in this movement.
I think so, but I also think there's an element of the wealthy who, if they change their lifestyles, will affect even faster than I change mine. I mean, I just wonder if there's any approach being made to that
They resist that
strata.
idea.
Yeah, I mean, I think these policy changes are that change the structural changes is the way that you get the behavior and the lifestyle changes. So that's just, as far as I can tell, it's much more about that than it is convincing people one at a time that they ought to do something. There's a story that I tell sometimes about a doctor in London back in the 1800s. His name was John Snow, and he was confronted with an epidemic of cholera, which is at that point was a pretty deadly illness. And they didn't even know about the germ theory of disease, but what John Snow did was he made a map and he marked out where every person with cholera lived and found that they were all lived in one neighborhood and they were all getting their water from one pump. So what did he do? He did not go around and knock on everyone's door and tell them not to drink the water. He took the handle off the pump. And because of that, he's called the father of public health. Because that's the kind of solution that we need. We need the take the handle off the pump kind of solutions. And we get those through our government, changing the way they spend our tax money.
But we also have the ability to make our own choices. Here in Missoula, we helped craft a Missoula Climate Action Plan for the city of Missoula, and we partnered with Northwestern Energy, which is our utility here. They picked 112 houses for this Green Blocks program to do a more extensive weatherization of 112 houses. So when they did the analysis and the blower door tests and checked the windows and everything else, they found that 47 of those 112 houses here in Missoula 3 years ago had no attic insulation. And the simplest things sometimes we don't even think about, and yet each of us, for a few $100 with almost immediate payback and then comfort, could make that simple change.
We could. We could. And what's happened in the U.S. is that we have examples of that all over the country because when our government would not sign the Kyoto Protocol, the U.S. Council of Mayors stepped up and said, we're going to do it. If you won't do it, we're going to do it. And so cities all across the country have made these plans, they have put these programs into effect, but you saw that thermometer, right? What we have to do now is we have to take these successes and we have to make them into national programs, because that's how we can get that kind of movement. We know what to do, and you're right. I mean, it's a 3 to 1 return on investment for home insulation. It's a 5 to 1 return on investment for bicycle paths. I mean, it's very clear what the right thing is to do. We know that it works. These things have been done all across the country, in cities and in rural areas, but we've got to scale them up now.
Thank you.
So how many of these endorsements for a prescription for climate action do you think you can winkle out of the health professionals of Missoula?
I love that.
Okay.
Anybody have an idea about what would be
35.
reasonable number? Well, should we make it a little?
You'll be meeting with the healthcare professional group tomorrow, I understand?
I will. What if we said 20? Do you think as a group that you could commit to getting 20?
Absolutely.
Yeah? I mean, if everybody asked a few people that they know, you think we could commit to getting 20? Okay.
So you're talking about like general, like doctors, or are you talking about vets and dentists and everybody else?
Everybody,
Okay.
everybody.
And how do they?
Physical therapists, you know, speech pathologists, we don't,
You have to take that.
psychologists, everybody's welcome.
Go on the website, and it takes about a minute to endorse, that's all.
Yeah. It's basically just telling Congress to get off their, you know what, and do what, and do what needs to be done, and that it's about health. So there's nothing controversial in it. And there's nothing that hasn't already been proven by experience. It's just a question of making what we all know needs to happen. So I would appreciate your help with that. If you can hound your healthcare people until we have 20 endorsements, that would be really great. I get an email every time one of them is done, so I will know.
So
Yeah.
you're speaking tomorrow where?
Oh, I'm going to talk at the Journal Club. That's it. And then I guess we're going to have a meeting with some health professionals later in the day too. But they don't know me, and then I'll be gone, and it takes a while to get these done. So I'm hoping that you can take this as one thing, one solid thing that you can do, and keep asking until we get those 20.
Okay.
Wendy, what about some of the health professionals that are here or that people here have connections with, doing a letter to the editor and just summarizing what's gone on here and making that request? That would reach a lot of people. I don't know how effective it might be, but it's worth trying.
We can write a letter to our.
I mean, anyone could write that letter, but it might be more effective if a healthcare professional.
Yeah, I'm not sure what the best way to do it is. I mean, the thing is that we're all terrifically busy, and we have to make it as easy as possible. I almost think maybe because it's something that people do online, that sending an email with a link to the website, to that particular section where you do the endorsement, might be the easiest thing, because then it's just a click.
I think that's true. We sent,
Yeah, that's the way to go.
We want to make it as easy as we can, and still have them feel that their voice is being represented. That's what I think we're working towards. And folks who want to do more, we need lots of help. But if we can just at least get those endorsements, because you know, most healthcare people are trained in science. We understand and we're concerned, but we're just having medicine is hard right now, and we're spending all our time trying to take care of our patients. And it's only you know, I do 6 months of doctoring and 6 months of activism. I just alternate because I can't do it when I'm taking care of patients either. So, but I want to go represent the health professionals of this community, and I can't do that unless they do those endorsements.
and there's nothing like that personal relationship, because we've been trying to organize healthcare professionals to at least demand on the coal issue that we look at human health implications. And, you know, out of seeking out hundreds and hundreds of healthcare professionals, we have like 20 responses. So it's difficult. And so as much as you know anyone and you ask them to do it, and you make it very easy, like you said, with an email, but if you don't know them, they're not even going to open that email.
Yeah.
So you
Yeah.
have to, or give them a call, a heads up, or that it's that personal contact that's needed.
And letting people know that there's something that they can do. You know, I think that a lot of the response that we've gotten has been people just saying, I feel like so happy and relieved that there's something now that I can do. Because we have to stop being helpless and stop waiting for big leaders, and all jump in and start doing. So thank you all so much.